We're going to get started here. I would like to invite everybody to the live chat on Osia 2, Baha 6 Max, and of course, Porous Implant Ear Reconstruction. We have Dr. Sheryl Lewin, Microtia ear surgeon, with us today, of course, hosting the event with our special guests, Amanda and Carla from Cochlear. And it's super exciting because we did this event a year ago, and this is kind of a follow-up on the Osia presentation a year ago now that we have a year worth of data and feedback from it. And with the Baha 6 just rolling out, that is super exciting as well. I also have a special guest, my son Manny, and he is less than 24 hours out getting his new Baha 6 Max bilateral processor is getting programmed. So I am Dr. Lewin's Microtia Patient Liaison, but I'm also a mother who, works with the bone conduction systems and know how important and critical it is, to his life. I'll let somebody in here. And in fact, I'm going to embarrass you for a second. It's so important though, like he is a dancer and even a tap dancer. And just think of how critical sound input is, for him to do what he loves. And being profoundly deaf, we went to the audiologist yesterday and they just could not believe, the level and the range of sound he could hear. She was kind of freaking out. So it was super exciting. So anyways, I think Amanda and Carla will let you start the presentation. And again, May is Better Speech and Hearing Month. So what a perfect time to do this presentation. Oh, and I would like to thank everybody coming. I did write down the countries. This is super exciting. The Philippines, London, Spain, Ecuador, Netherlands, Canada, Hungary, Romania, and of course, all around the United States. So everybody is tuning in. It's going to be a great one.
Thanks, Tiffany. Well, I will take it away and introduce myself and my colleague, Carla. We're so happy you could all join us from around the world. I think after a year of not traveling, this is my most multicultural event for sure, and well over a year. So happy you could all join us. I am an audiologist by training. So prior to joining Cochlear, I worked in private practice with, bone conduction and cochlear implant devices, working with lots of patients from very young to very old. And really now my job is to support the surgeons in the greater LA area, the audiologists, make sure that they're trained to work with our solutions, and really on advocacy and awareness. So events like this to teach patients and candidates about these solutions and how they can improve their quality of life and their hearing through Baha or Osia. And then I'm going to let Carla introduce herself as well.
Hi, everyone. I live in Long Beach, California, and I'm happy to be here. Y para todos ustedes que hablan español, les doy la bienvenida. So I speak Spanish, and I just really enjoy working with all of our candidates for different implantable hearing devices. So thank you for having me, and here we go.
All right, so we have lots that we want to talk with you about today, and we do want to have a nice conversation where Dr. Lewin will chime in with her expertise as well and her experiences with Baha and Osia. And thank you all so much for submitting questions ahead of time so that we could really cover the information that's important to you. So this is our agenda for today with Osia. We want to help you understand the difference from the Baha system and what the benefits are, the advantages of Osia, some of the commonly asked questions when it comes to Osia, and then our Baha 6 Max sound processor, which just came out last month, to understand what improvements there are over the Baha 5, and if you're out there with the Baha 5 or anything older, how you would go about that upgrade process to get that new Baha 6. We will hopefully, again, have some time at the end for questions, or can always follow up with you individually if you have questions that we don't get to. So let's start off with Osia. And it's almost like we're relaunching Osia in a way because of COVID. So Osia launched in the United States. It was the first country to globally launch Osia last February. So we got going, and then immediately COVID happened and we slowed down, and then we got going again. And actually Dr. Lewin has some great experience in just a year She's done 13 Osia surgeries, which she can talk more about towards the end and share her experience, but it's almost like we're relaunching it and teaching people about it for the first time again. So just to help you all understand who is a candidate for Osia, so who we would recommend Osia to. So in the United States, it is approved for use 12 years and older, and that's an FDA indication. So when Cochlear comes out with a new device, we have to get approved by the FDA. And when we're talking to all of you who are also working with Dr. Lewin for the ear reconstruction, we're talking about conductive hearing loss. So, you know, your kiddos or maybe yourself, you likely have normal bone conduction hearing, meaning your cochlea works perfectly fine, but we just need some help delivering that sound to the inner ear. And so a bone conduction system is the perfect way to do that by bypassing that outer and middle ear and going right to the cochlea. So we see kind of who's a candidate here. And this is again, our US indications. Yep.
Oh, so I wanted to just clarify, because my understanding is that in the Canada and in Europe, they are approved to do the Osia at 5 years of age. Is that correct?
Yes. So each country or body essentially has their own approving system. So in Health Canada has approved Osia for 5 years and older. In Europe, it is 5 years and older. And then in the US, it is 12 years and older. So I can speak to in the US what our current indication is. And Dr. Lewin, I know you're going to talk a bit later about Osia Age.
Yeah. When I get to my portion of the talk at the end, I'm going to cover sort of practically what my practice is doing, which is maybe a little bit different than what you've described.
Great. So when we look here and you see this shaded graph on the other side on the right, all that's showing is that we can fit up to 55 decibels of bone conduction loss. So again, there's a huge fitting range, and for individuals like yourselves who likely have normal bone conduction, you know, we have no concerns about having enough power in this device, even if your hearing changed in the future. So this is a nice graphic to better understand or explain how the sound is delivered to the inner ear with the Baha versus the Osia. So I'm going to go through and help you understand these different parts. So first, we're going to look at where the microphone is located on Baha compared to Osia. And for this part of the device, it's very similar. So you see that microphone, we have the Baha on an abutment. So that's just like Manny's devices there. We have the Baha Attract, which is our magnetic solution. And then we have the Osia on the right. So in all three cases, our microphones that are going to pick up the sound are on the processor itself on the outside. So there's two microphones there to help you hear really well in noisy situations, to help you locate sound. And those are going to be on the outside for all of our devices. So that's pretty easy to understand. The biggest difference really is that vibration. Where is the sound vibration being created that's delivered to the cochlea? So with the Baha, we can see that the vibrating part is inside of the Baha processor. So outside of the skin in the processor itself. With Osia, what's really different is the vibrating piece is here under the skin. So you can see how much thinner we made it so that it could easily go under the skin. And the technology inside is pretty different. It's more powerful and it's more reliable over time because we're putting it under the skin. We want to make sure that it lasts and that your child or yourself only need to have one surgery. So this piece here is the big difference, that the vibrations are happening under the skin with Osia compared to Baha. And then the letter C stands for connection type. So you can see with the abutment, we're actually going through the skin. And so before Osia was available, this was really going to provide the best hearing outcomes. So we're going directly through the skin into the bone. With Attract, we were able to get that advantage of a cosmetic, appeal, nothing coming through the skin, but we did need to send the signal through all of that skin and tissue. And so we did lose some of that amplification. And the Osia, I like to say it's like the two Baha systems had a baby. And here we have something that's nice from a cosmetic perspective. So nothing coming through the skin, no sort of wound care, but we're delivering the best sound outcomes by putting that, again, transducer or vibrator underneath. So it's still a magnetic connection, nothing coming through the skin, but we're moving that vibrator underneath to give us better outcomes. So hopefully that helps you understand how these two systems are different, and will lend to the discussion we're going to have about the hearing outcomes with Osia. So this is another little side profile of what Osia looks like when it's put under the skin by Dr. Lewin in surgery. So there's only a very small amount of bone, and this is exactly like a Baha. So we start with this little screw or implant that's 3 or 4 millimeters long, and we put that into the bone. And Dr. Lewin, do you typically use 3 or 4? Does it depend on the patient?
It does depend on the patient, and really, I have had great success with 3 millimeters, and it's to me a little bit safer, and we haven't had any concerns or problems with osseointegration at that length. But and because I do so many kids that are young, the majority of my kids are much younger than 12 years old for all hearing implants that I do, but also with Osia. So I prefer the 3 unless it's an adult.
And that's great. And when we look at our studies, we see the same reliability and stability with that 3 millimeter as the 4. So it really can depend on the surgeon's preference or the patient's anatomy. But we have those 2 options, again, whatever safest for the patient, but very little amount of bone removed. And this is, again, the same foundation that would be used for a Baha device and has been used for years. So we know it's very reliable. The osseointegration is very strong, and it's actually very strong from day one. This new implant from years ago is very strong on day one, even stronger than our previous generation after 6 months. So this is a nice profile. And what you see with Osia is there's 2 pieces. This implant goes in, and then we screw into that implant this Osia piece. So this whole kind of silicone piece, and then the metal, what we call transducer or vibrator here at the end, is all one piece, and it just gets screwed into that implant here. And that's what's going to do all the work under the skin. So again, we needed to reduce the size so we could put it underneath. And really, this is where all the power happens. This also will help explain some of the differences. We had some questions about, where the implant's located, and even if you have a Baha device, transitioning to an Osia in the future. So this might demonstrate exactly where the implant goes. So with the Baha system, the implant is usually placed kind of up near the top of the earlobe or pinna, and then the processor snaps right into it or connects with the magnet. So everything's up here in this area. Where with an Osia, the implant's put a bit lower, kind of in line with your ear canal if you draw a line straight back. And then the processor is still going to sit in about the same location, because that's where the magnet is. So the magnet that it connects to is up here in this circular part. So the implant location is a bit different. We're actually getting closer to the inner ear with the Osia implant. So that also lends itself to even better hearing outcomes. Now, these are the positions if you're getting an ear surgery for the first time, you've never had a device before. But if Dr. Lewin is working with a transition patient, so maybe they had an abutment in the past and they would like to move to an Osia system, then she might rotate this coil, this circular piece, slightly back, or move the whole position of the device further back, so that we're not resting this Osia silicone coil on top of the old implant. So you can see here, because of these locations being pretty similar, she may just rotate that device or move it a little bit further back. And Dr. Lewin, maybe you can speak to that too. I know every case is unique.
Yeah, well, it really does depend where the original surgeon who put the Baha implant in place. So, there's, I suppose, the potential if they put the Baha too low that you could almost use that implant and swap it out. I haven't had that occurrence yet. More often, unfortunately, it seems higher than where we recommend, because I think for whatever reason, if it was done young, sometimes the thicker bone is up higher. So I have one of these patients tomorrow who's transitioning from a Baha placed, probably 10 years ago. And I noticed I took out my little template, and I can put it in the proper position, and his implant sitting kind of in that neck, the skinniest part. So I can sort of position my Osia so that it's kind of around around the actual implant. Otherwise, I do what you drew here, angle it backwards until I'm out of the way.
And that's a great point. So Dr. Lewin uses this template, kind of a little silicone dummy prior to surgery, to plot out and plan exactly how she's going to position the device, you know, whether it's a new surgery or if it's a transition and we want to avoid that old implant. But kind of key to remember here is very likely they're going to put a new implant in, so lower and in the correct position for Osia. And then depending on your anatomy or previous device history, she can plot out and plan exactly how to position that Osia, so that we are avoiding the old implant, but also giving you the best hearing outcomes. And when we talk about hearing outcomes, the amazing part about Osia is before we would think about an abutment delivering the best hearing, because it's direct to bone, this graph is actually comparing Osia to the Baha on an abutment. And we're seeing that we're getting over 10 decibels more in those high frequencies with the Osia system. So I like to say Osia really has become the gold standard when it comes to hearing. And Carla's history or background is in education. So I'm going to have her explain a little bit more about why this is so important for your kiddos, especially when we talk about speech, language, and hearing.
Thank you, Amanda. So as Amanda shared, I am a former teacher of the deaf. And so sound and speech are very important to the development of your children in their learning in all aspects. And so as we look at this graph here, it plots out where all of those consonant sounds are in the English language. But I want to turn your attention to the top right portion of this graph. And if you're on a phone, I'll go ahead and say those sounds. So it's F like in Frank, S like in Sam, and TH like as in describing the thickness of something. In order to be able to produce those sounds properly, we want the child to have clear access to these sounds. This is important also in environmental sounds. So when you think about your children who are developing language, we want to make sure that they have the same access to a woman's voice that they do to a man's voice, that they can hear a whisper, a cat purring, or maybe the dog's nails on a hardwood floor. All of these environmental sounds, plus the sounds that we talked about up at the very top of this grid, are extremely important. And what Osia provides us with is the ability to provide access to learning those sounds that is vital to learning how to read and to produce those sounds appropriately when they're talking.
Thanks, Carla. I'm even going to go back just real quick to the previous slide, because I wanted to note that we do have clinical evidence studies on both Baha compared to our first generation of Osia, which never launched in the US, was just more for our clinical trials. And then now with Osia 2, which is available for the last year in the United States and now across the world. But we have some studies to show, again, these benefits compared to an abutment. But if you have an attract system, what we're seeing is that patients might hear 30 to 40 decibels better in those high frequencies, because we're not having to go through the skin, we're not losing any of those high pitches. So a huge hearing difference when we think about how noisy classrooms are, how busy kids are, all the activities that they do. So those high pitched sounds are really important for speech and hearing. And when we compare to either an abutment or an attract with a magnet, really just a huge benefit when we talk about Osia and the hearing outcomes that it can produce. So that lends to all of the advantage of the Osia system, and we're just going to go down the list to help you better understand really why this is the gold standard when it comes to a surgical solution. So we have that improved hearing that Carla just talked about, of those high-pitched sounds, those consonant sounds for speech, language, reading development. That's going to help your child understand better in noisy environments. So again, classrooms are very noisy, and honestly, kids just in general are in noisy environments most of their day. compared to some of our older patients who might be in quiet more often. So being able to pick up those high-pitched sounds are going to help them do better in noise. One thing that we're seeing is really important is that patients are wearing their Osia for more hours per day because it's more comfortable. The part that's vibrating is now under the skin. So there's nothing vibrating here on the outside. There's nothing vibrating on a magnet. And so they find it really comfortable because the processor is really light, easy to wear. And so they're wearing it about 12 hours per day compared to about 8 hours per day with their Baha device. So that's really good to see. Overall, patients who received an Osia and they moved over from Baha reported that there was an improvement in how the quality of the sound was coming through, the clarity, and how their own voice sounded. So again, by putting that vibrating piece under the skin, it just sounded better to them. Feedback. So anytime you put on a baseball cap or you get too close to the window in the car with the Baha, you might get a little bit of feedback because the sound is going back into the microphone. Well, with Osia, you're putting that vibration under the skin. We don't have to worry about feedback anymore. You can wear anything on your head. You can get close to the walls and the windows. You don't have any whistling sound. I mentioned it's nice and lightweight and low profile. And Carla's going to be able to demonstrate how it looks on the head in a minute. And this might seem like something little, but families are really excited that they now have a waterproof option with Osia. And we're going to talk about that a little bit more here. So if you're moving forward and Osia is in your future, Carla's going to tell you what to expect when you get your new system.
So we are so excited to share that the Osia 2 does have its own Aqua Plus kit. And it's just like a clamshell. So here's my Osia, and it would just close on top of it. And you would simply just put it on. And you can send your child out to play in water. So we're excited for you to know that all of those sounds in water play, your child will continue to enjoy with their Osia on. The Osia does come in all of these color selections. And so you get every color that's on this screen. You don't necessarily have to choose. I've seen lots of savvy moms get, changing certain things about maybe adding stickers. So we've seen a lot of exciting things that moms are doing with some of these colors.
And I mentioned that processor being lighter. So just to give you an idea, so it's about 10% lighter than a Baha that goes on an abutment. And it's about 40% lighter than an attract, because with the track, you have to also have an external magnet. So it is lighter than both of the Baha solutions, and Carla showed it's really low profile. So again, it looks a bit wider than a Baha, but then it sits nice and low profile to the head.
Good point, Amanda. And it does come in different magnet strengths. And why we bring that up is for you just to have the knowledge that your audiologist is going to work with you, depending on the child's age and maybe how thick their hair is. Your audiologist is going to choose a magnet strength that's going to work best for your child. And then retention. So we're talking about a very small device, and you probably want to know, how do I know that my child's not going to come home from school with it? Cochlear's thought about those things. So we do have retention options that are as simple as putting in a clip and making sure that there's a little bit of a safety onto the child's shirt or maybe into their hair. We also have a headband, and it's as easy as opening up this headband pocket. Let's see if I find this pocket here, popping it in, and putting the headband on. So we have a retention option for all kinds of activities. And we hope that you find this as kind of a security for you to know that your child's going to come home from school with their Osia. And your Osia is also going to come with accessories similar to the Baha system. So if you already have a Baha system, you might have a mini microphone or a television streamer. But I really do want to make sure that I draw your attention to that mini microphone. As Amanda shared, classrooms are noisy. And so a mini microphone is definitely going to be a teacher's best friend in order to make sure that your child is getting the clearest signal of his or her voice directly into their sound processor. We can go into all of the other accessories, but I think really highlighting the Aqua Plus for Osia and the mini microphone, those are really great pediatric accessories for Osia. So those are just some of the highlights about Osia, and Amanda's going to take us into the next technology.
Thanks, Carla. And I wanted to add just a little bit about Osia. Obviously, 2020 was an unprecedented year, but this direct streaming that we have to iPhone or made for iPhone devices, like an iPad, was so important this past year. Kids were able to, if they had a tablet from school, stream directly into their device and hear their classroom, hear their teacher through Zoom, just like we're doing now. They could also say they were using a laptop. They could take that mini microphone, plug it into the laptop. The parent could even use a splitter so that they could listen too. But this sort of technology was really important during virtual learning, and knowing that some kids still haven't gone back to in-person, these accessories and technology are really key to make sure that they're hearing their best. So if you already are using a Baha on a softband, so that's really how we start out with that softband solution when your child is very young, they're going to be able to use their same accessories that they use with their Baha with Osia. So just so you know, they're compatible, they're the same accessories between Baha and Osia.
Great point. Thanks, Amanda.
And let me just speak to how important streaming is. The first thing we did when we got in that car was pair the new Baha 6 Maxes to the phone. So I don't know that he really even cares about the higher frequencies and all the improved hearing. He just cares that it streams right into the iPhone. So that's always been a perk, just like the Baha 5s, but that is key. Do you mind if I ask just a couple real quick questions about the Osia that people have put in chat before we switch over? Is there any, Elizabeth asks, any feedback from patients about how it feels? Can they feel the vibration under the skin?
So I'd say that I have not heard that they can feel the vibration. I think with patients who have microtia and they have normal bone conduction, if anything, the Osia has so much power. If they've never worn a device before, or maybe only used a device on a softband, what I see happening at their first activation appointment is we might even just turn it down a little bit to help them acclimate. So I wouldn't say that they've said they feel anything, but they just notice a significant difference from what they've been using or from not hearing at all on that side. And so just knowing that when you go to that first appointment, it's okay if the volume needs to come down to maybe acclimate, over time, over the first month or 2 months. I know even for Manny getting the Baha 6 with more high frequencies, we turned it down a little bit to help him get used to it and then build up to his prescription. So I haven't heard anything about being able to feel the vibration. As far as the processor itself, it is super light. So most people forget it's there, other than getting used to, especially with masks, not knocking something off when you go to fix your hair or you touch your hair. So that's really all I've heard. The hair clip is really nice for people because if they do accidentally knock it off, it's not going anywhere. It's staying really nice and clipped into the hair. So that's what I've heard as far as like being able to feel vibrations.
Yeah, I haven't seen a lot of that like posted in the groups. I know originally there were some comments. What I've seen like in the groups mostly was some of the comments initially, like a year ago, that there was some like feedback or buzzing, but it sounds like you like rolled out something, shortly thereafter to, get that.
Yeah. So, and that's where we launched Osia in the US before anywhere else, which is kind of our biggest group of patients in the world that receive bone conduction devices. And so we were learning in the beginning. And I think what we detected and COVID slowed down the solution a little bit, going back and forth. But what we found is some patients were experiencing kind of a static or buzzing sound, and we were able to come out with a software update, kind of a firmware update to just the processor. And then that was able to eliminate the static for those patients. So that's definitely something to tell your audiologist about, because now we have something in the software that they can just activate and should get rid of any sort of sound quality issue. And I should also just mention about the vibrating, that piece that's under the skin with Osia, that whole piece doesn't even vibrate actually. It's all happening within that metal casing. So the piece itself doesn't actually move and vibrate. It's all kind of happening within the casing. So that also is probably why people don't feel it or perceive it under the skin.
Okay, great. Another question from Joey. Any data on complication rates?
So I believe we do have data, just because we do have to report on reliability. Because we usually gather that data on an annual basis, so Osia has been just out for over a year, I can probably get back with more details, specifically on the implant, so the foundational screw. We know that piece is over 99.8% reliable, so highly reliable. As far as the Osia as a whole, I can definitely get back to you. I just know we really, we have had no issues or concerns with the internal device. So I can get a more firm percentage, but I can tell you it's been going really well. We've had minimal complications.
Great. Just because of time, I think we'll move on to the Baha 6 Max. And if we do have time at the end, we can head on to some additional questions. Otherwise, we can put you in touch with Amanda and Carla to answer them directly.
Okay, great. So Baha 6 Max is our new Baha sound processor, and Manny's going to be our live Baha 6 model. Luckily, he was able to get fit yesterday bilaterally. So we just launched this at the end of March. I think I said last month, but I honestly don't know what day it is most of the time anymore. Kind of lose track of time. So to give you a little bit of a timeline, over 5 years ago, we launched Baha 5. And that had a 45 decibel fitting range and a nice small processor. It had that first made for iPhone streaming, the smart app to help with monitoring or control of the device. And then in 2019, Ponto 4 followed with a 45 dB fitting range. We also had the Baha 5 Power, so you can see in size, a larger device that could fit up to 55 decibels of hearing loss. And again, that's been out for over 5 years with the same streaming abilities. And so when we thought about our patients, we really wanted to combine the best of both worlds. We wanted to keep that nice small size, but be able to provide more power and better hearing, whether that's overall hearing quality and clarity. But that's really where Baha 6 was born, to combine that small size with the power of the Baha 5 power device. So we have all of the power of this guy in a tiny little Baha 6. We also redesigned the transducer. So again, that's that vibrating part on the inside to be stronger and more efficient, which is going to lead to better battery life. I'm going to talk about that in a second. And then the computer chip on the inside is also brand new, and it allows us to do more with listening to the signal or the sound and then adjusting it to make it clear for your child or for the patient. So I talked about that vibrating piece becoming more efficient. We're getting over 50% more battery life with Baha 6. So I know Manny just got his yesterday, so you probably can't speak to it, but you were having quite a struggle with batteries. And now what we see, so say kids with Microtia who have a conductive hearing loss, we're seeing that they're probably going to get 10 to 14 days on their little 312 battery. So it's going to be the same size battery as a Baha 5. So they're really getting a huge benefit when it comes to battery life. If you add in streaming with the mimimic or direct from the phone, it's going to reduce the battery a little bit, but only about 10%. So we are expecting significantly more battery life if you compare it to a Baha 5. And then we talk about that power efficiency. So if we compare the Baha 6 Max to the Baha 5, and they are very similar in size, but what we can see, so the Baha 5 is our black line, and then the Baha 6 Max is our yellow line. is that we're getting more power at all of the pitches. So we think about the keys on the piano, every single key, we're getting more power out of the Baha 6. We can also see on the right part of this graph how the yellow line comes out further. We're also getting higher frequencies that we've never been able to get before with the Baha 5. So think about it again like the piano. With the Baha 5, we could stimulate or help a patient hear 60% of our piano keys. And now with the Baha 6, we're able to open it up and hear 100% of the piano keys. So again, that's going to equate to better hearing, better sound quality, which you're going to see in the next couple of slides. But kind of think about that piano analogy when we talk about something called bandwidth, so the range of sounds that you can hear. And if you were to take a Baha 5 patient, put them into a sound booth at the audiologist's office and test their hearing with their device on, we would typically see that in the high pitched sounds, the hearing's going to drop a little bit. They're not hearing those sounds as well. You can see up here, these are the different pitches from the low bass tones all the way across to the high pitched sounds. And then the loudness on the left side of the graph from very, very quiet to very loud. Now at the Baha 6, we can see what an improvement they're getting in those high frequencies. They're hearing, you know, in this case, almost 30 dB better, 30 decibels better at some of those high frequencies. So that goes back to if you're upgrading, it might even be so different that on the first day, they turn it down a little bit to help you adjust, but your brain will adjust, get used to hearing more of these high pitched sounds, and then you'll be able to turn it back up and really fully benefit. And for anybody out there with a Baha 5 who's thinking about upgrading, just know that the Baha 6 works with any of the connection types. So it works in our current softbands or soundarcs for non-surgical solutions, or if you have an attract, so the magnet, or a connect with the abutment, it's going to snap into all of those connection types. And this is also really exciting is we have a new low pro snap coupling. So the way that it snaps in is different. It's one, much stronger than before. So the design is going to hold up, be really durable to snapping it on and off, especially with kids who are hard on their devices. But you can see that it's 2 millimeters closer. And that might not sound like a lot, but think about how small this is overall. 2 millimeters out of 15 is actually a pretty significant percentage, and noticeably closer and less projection. So this is compared on an abutment, and then this is compared on a magnet. So again, with the magnet, probably even more important because we have to add in that external piece. It's going to get it even closer. This also helps reduce the feedback because it's not projecting as much. So less feedback and whistling, and we also redesigned that feedback manager. So overall, we're noticing less feedback with the Baha 6. Tiffany, do you want to share anything about that new low pro coupling for Manny?
Yeah, I mean, we've just had it less than a day or whatever, but I totally, noticed the difference. I don't, this is the old one, and you can kind of see how it really sticks out, and now it's probably getting hard to see, but it's no different than what you just showed. But it really does. It is much closer to his head, and we've even had longer abutments put on in the past. As he's gotten older, just to make sure there was no skin overgrowth or anything, and that always, kind of took away any potential issues we had. But I really like when you look straight on, you don't see it at all, and we used to see it. So even though it just says like a couple millimeter difference, it doesn't sound like a lot, but it really is a lot. So
probably makes a big difference if you're trying to fit a baseball helmet over the top of
it. Exactly. Well, for baseball, we actually always go back to the softband, and then mommy doesn't have to come in the dugout because apparently that's a no-no. But you just put on a softband, and he throws just one on a softband here. A lot of people ask this, and then when he goes to bat, he just puts it here under his helmet. And so, people are kind of adjusting helmets and kind of doing, I don't know if you're supposed to be doing that, but it works super slick. So
yeah, that's a great solution. Well, people so far who are upgrading are really excited about the new coupling, the fact that it's even stronger than before. So just making sure it's durable over time. And then we have some additional pediatric features. So in the past, you had to go up to the Baha 5 Power, the bigger device, to get this little indicator light that could tell a parent if their child's hearing and in sound. So now we have that on the small little processor, so that can be turned on by the audiologist. So there's a pediatric setting where you can just see a kind of a constant green flashing light to let you know that they're hearing, that the device is on, has good battery. You could also set it to kind of a just on mode where it's only going to blink when something's changing, the volume, the program, you're activating streaming, or you can turn it completely off. So there's an indicator light option there. And then we have a new color. So we really love this mint color, and it's been really popular. We have our traditional 5 colors here, and then a fun new mint color there in the bottom left, which again, I think we've seen be even more popular than we imagined. And really exciting as well is this is the first bone conduction processor that also has direct streaming for Android. So just like with the Baha 5, we have direct streaming to iPhone, iPads, but now we also have it for Android. And we have a nice little website. It's www.cochlear.com/compatibility. I might have Carla type it into the chat, where you can go and see exactly what phones are compatible for the direct streaming. If your phone isn't compatible, you can always use the phone clip accessory for streaming. But again, it's typically with Android, every manufacturer is different. So it's going to be your Samsung phones, your Google phones right now, and we're always working to add more devices to that list. So that's pretty cool. First ever bone conduction device to have that feature. And then we have an all new Baha Smart app for Baha 6. So this is great for parents for monitoring. It also works with your Apple Watch. So you could get a notification that the battery is low, or if the device is turned off for any reason, or change programs. If you're using that mini mic, say in the car, the kids in the back seat, and you want to utilize that, you could activate the streaming to the mini mic off your watch or your phone. So lots of cool features in that app, and very important is find by processor. So if the processor ever goes missing, and my favorite story is a little girl hiding her processor in her toy cash register, you can use that Find My Processor feature and either use the hot and cold or like a GPS to figure out where that was left. So if we look at the summary of our Baha 6 advantages, we have that broader range of sound, that full set of piano keys out to almost 10,000 hertz. So really nice improvement there, which is going to lend to better hearing and noise again, better sound quality. It has the most power out of any bone conduction device in that small little processor. It's going to get that better speech understanding, and we have some data to show how much better patients are hearing in noise. So even at 10 decibels lower, they're able to detect words and understand words, which is pretty significant when we talk about hearing, say in the classroom. Patients who upgraded report that it's 25% better in the quality of the sound and 35% better in the clarity, over 50% more battery life. We've got that new low pro design, the pediatric light for monitoring, and then the direct streaming to Apple and Android. So a little summary there, and feel free to take a picture of this slide if you just want a roundup of all these features. But we are seeing lots of upgrades coming through, and very excited that we're able to deliver this technology. I know it was a long wait, but hopefully for people, you feel it's worth it. And we'll have to get Manny's feedback once he's more than 24 hours out.
Yes,
The last thing I almost forgot is that new app feature does have an option to do remote firmware updates. That might sound foreign to all of you, but what it means is instead of having to go to the audiologist for a software firmware update, you just do it straight from your app in the comfort of your home. So maybe a new Android phone becomes compatible. Instead of having to go see your audiologist, you just download that from home. That's really going to help with future technology and software updates.
very cool. I have a couple of quick questions if you don't mind.
Yeah.
Somebody had asked, why, if both the Osia and the Baha 6 attract, if you're done, Amanda, maybe stop sharing, or
Sure.
maybe stop sharing. If they're both magnet, like why have the Osia?
Between attract and Osia, you said?
Right.
So that comes down to where that vibrating piece is located. So the Osia is going to take that vibrating piece and put it under the skin. And so that vibration is going to go directly from the Osia under the skin into the implant in the bone. So we don't lose any sound or power going through the skin. Compared to an attract, it has significantly more hearing in the high pitched sounds. So we think about even like 30 to 40 decibels more at those high pitches, because they're really the ones most affected by going through the skin. The bass tend to get through the skin pretty well, but it's those high pitched sounds. So with the tract, the vibrations are happening inside the Baha processor. And so it's out here, and the vibrations have to go through the skin to the inside device and then down to the hearing or into the cochlea. So we're just shortening that path. We're getting closer to where we want to hear the sound in the ear. The design is also very different. So the part that vibrates is stronger. It's made out of this new material, which I could nerd out on and get very technical about, but it's this new material that creates a very strong and clear vibration of sound.
Great. Well, I think we're gonna bypass some of the other questions quick, because I want to make sure Dr. Lewin has time to share her very important information. If we have time at the end, we'll hit some of the other questions. Oh, look at you. You're so fancy, Dr. Lewin.
Just barely made that work, but we're okay if you guys.
Someone's been having some technical stress in the background.
We're good. I can't see any people, but I'll just go ahead and start my talk here.
You're good.
Okay, so thank you, all of you, for attending. We really appreciate, we had a lot of fun with these live chats last summer, and since they've been very well attended, we will continue bringing those, and I thought this was very topical. I do want to thank Cochlear, because they've been a wonderful partner with my practice, and they have fabulous customer service, and I have been very impressed with their products, and we have a very nice, wonderful relationship. So I kind of just wanted people, these are little ear models, obviously, but with actual demo devices. So these are the differences between the different devices. Baha Connect on the left of your screen, Baha Attract in the middle where you can see the magnet, and the Osia 2. And this sort of, is a point that Amanda's already talked about, but I did want people to understand where surgery is taking place for these. So the underskin portion of the Osia is what you see here. And that's why that little tiny magnet that says demo, it's actually much smaller than the magnet on the Baha Attract. That's what's holding your outside microphone and processor in place. And the transducer or vibration portion of the implant is at that lower point where it says cochlear on this Osia. So, being part surgeon, part architect, I like bisecting things and looking at cross sections. So forgive me, but if you did bisect all of these, kind of similar to the picture that Amanda was showing you, on each of these little drawings, the bone is represented by that tan color, the skin is represented by the peachy color, and then the device, of course. And so what you notice is, as Amanda said, the devices are all identical. So that's why I am very comfortable to put an Osia on a 5-year-old, because I've been doing the exact same thing on, all the children that I've put Bahas into. So the only difference really is, there's more than one difference, but the primary difference is that the implant is placed, a couple centimeters lower. And so if the bone isn't thick enough in those younger age groups, there's a limit to whether we can put it in if the bone's not thick enough. So the big question for everybody to understand is, which comes first? Would it be the 3D Lewin ear or the bone conduction hearing implant? And my take on that is, ideally they can be placed at the same time. And this is one of my patients who did have his Baha Attract placed at the same time as he had his Lewin ear made. And so he just had one surgery and done. But this young lady had surgery many, many, many years ago, and she did not have she was probably too tiny, honestly, to get a Baha at that time. So many years later, when she was maybe 9 or maybe even, yeah, right around 9. I think she came back and we put the Osia in at that time, and we switched out, we just happened to swap out her 2-piece ear for a new 1-piece ear. So this is a 1-piece Lewin ear. So that's an example of after surgery. The one thing I caution is not to do any of these hearing implants before the ear surgery, and more particularly, the Osia is a bigger issue for me than the Baha, and I'm trying to explain why here. So here's a Microtia patient of mine. This is where I planned to place his ear. This is where I planned to put to take the fascia flap. So although no incisions are done, if you were living under his scalp, there's this fascial layer of tissue that will cover his implant, and it has these blood vessels I need, and they're located in this area. But if we're putting the Osia in where it should be ideally from an anatomy standpoint, you can see that the Osia, had it been done first, would be sitting on top or ruining that portion of the fascial flap. So it limits my sort of freedom of what I can do in the OR, and potentially can injure blood vessels that I would be relying on. So we really, really do not want to have the Osia done first. But in this child's case, here he is maybe 6 months after surgery. And if you look closely, well, let me show you, this is where the Osia would go. And what I can now do is actually go right back through this same scar. It's a little hard to see on your screens possibly, but that white line is the exact scar that he had, you know, from his original surgery where his skin graft was sewn in. And we really don't even have to touch his ear, because his ear came out fine. We wouldn't really need to do any secondary surgery, but I can use that scar to place the Osia, you know, without any scars in the scalp. Now, I will say you don't have to come to my practice to get an Osia. There's, you know, many surgeons, primarily ENT surgeons, I'm guessing, that are happy to place these. However, my understanding is they would likely put some incision in the hair-bearing scalp. So I have done 12 Osia since it was released last February. 8 of them have been at the same time as making the reconstructed ear. 4 of them have been the second stage, so they're coming back for something else, and we do the Osia at that time. Interestingly, just in 1 year, this is my balance between Osia and Baha in my practice, and this is going to change dramatically in 3 months, because I will have added 10 more Osia to this list, so 22 by then. So clearly, you know, at least within my practice, there is a very heavy lean towards Osia at this point. And this is my age range. Only 3 of my patients have been 12 years or older. And that's just, as I said, due to the population of patients I'm seeing having surgery, and, you know, the desire to get these devices done prior to age 12. And we do many, many things in medicine that are considered off-label or different from, you know, let's say FDA strict guidelines, in the sense in medicine, we you know, sort of if it's a very well-proven technique. So the comfort level, I think, of most ENTs and plastic surgeons that do this, it's identical equipment and process, everything identical to a Baha. So I think that's where the comfort zone is in doing it younger, as well as the fact that other countries also do it at 5. So that's it for my talk. Just wanted to get those few little points in, and I don't know, maybe we can.
Yeah, no, I thought that was awesome. And I guess the other thing I want to add is that although we converted from the Baha 5 to the 6, like that Osia is hot on my radar. And even though it wasn't the right time for us for a variety of reasons, I'm pretty sure that we will be converting to that. Perhaps maybe when he isn't doing 14 back flips in a row from dancing. But it is on our radar because the sound improvement is just crazy. But I'm already so happy with the Baha 6, and I'm just, you know, so grateful for, you know, Cochlear to always be pushing this technology and always, you know, leading it, and people playing catch up and everything like that, and also being responsive when people do have some comments or, the feedback that things aren't working, that they're out to, like actually my audiologist says, there was an update actually this morning, on the Baha 6 Max. She's hurrying up to try to do the update before we come in. So, and everybody's, super ready to help. And, I love that too. So just like Dr. Lewin.
Yeah, I'll tell you, I'll frequently have a consultation with parents of an infant, and just the other day, I have a 3-month-old baby, mom and dad calling me from actually Chile, and they knew so much in such a young age, and they were looking at all kinds of hearing systems, even ones we don't have here in the US. And I told them, by the time your child is ready for a permanent surgical solution, we're going to be talking about stuff that none of us have heard of yet. It's just the technology is that impressively moving forward. So that's, super exciting for me, for my patients.
Definitely. One last question, because I know we've hit our hour, and I like to wrap it up then, because I feel like people's attention span are long gone. But the mini mic question was, does the mini mic work with the Osia? I'll let Amanda or Carla go ahead.
Absolutely. The mini mic works with the Osia. It works with the Baha. It actually works with our cochlear implants as well. So that mini mic is versatile.
Yes, I know that's what he uses at school, and it's very discreet, which is nice as you get older, that, the teacher isn't wearing some big old get up and, you're passing it from teacher to teacher, that it's not, such a production.
Yeah. And not only that, Tiffany, if a teacher has more than one student in their classroom that has maybe a cochlear implant or a Baha or an Osia, all of those kids can pair into one mini microphone. So it is a teacher's best friend. And I can say that because I am a teacher.
And before we leave here, can I just say too, the swag bags, this is one for if your kid's bilateral, backpack 1, backpack 2, right? Do you get any of them, or do I get both? So that was like Christmas yesterday too. So, well, I think we are going to wrap it up. I know there's a lot of additional questions, and our email is info@lewinmd.com. We did not actually get to a lot of the questions because we had so much information to get to everyone, but feel free, if they weren't answered today, send them my way. I will forward them right out to Amanda and Carla. When we post this video online, I believe it has their contact information. We can do that, but we're happy to help you. But I do appreciate everybody tuning in, and I see a lot of people saying hi. So hi, Gabriel. But anyways,
hi, Gabriel.
Have a great day.
I love it.
And thank you, everyone, for attending the live chat.
Thank you, everybody. I love seeing all my patients and their parents. I see I see Mia. I see Joey. It's awesome. Robin. So great.
He
Melissa.
wanted to say hi to you personally, Dr. Lewin, but he's playing varsity baseball as a freshman, so he's doing well. He's doing well.
Good. Awesome. Well, thanks, everybody. We really appreciate it, and we'll see you at the next live chat.
All right.
Thank
See you
you.
later. Bye.
Thank you. Bye-bye.
Bye.